Today I want to announce that we will be putting into place a $17.5 million plan to protect our health heroes. So Minister Miles will talk a little bit more about that, but we raised it yesterday that we were looking at securing some hotels, especially for our workers that are going to be doing those long shifts and may not be able to go home to their loved ones because there may be a member of their family that is vulnerable. So I'll get Minister Miles to talk more about that. Can I absolutely endorse Mayor Tom Tate's call today to close 3 beaches, that being the Spit, Surfers Paradise and Coolangatta. He discussed this with me and I 100% endorse that. We have been giving warnings now for a long time to people and unfortunately they are not adhering by the social distancing. If we are really going to suppress this virus, we have to be making sure, need to make sure we are doing everything we possibly can to limit the spread. And the way you limit that spread is by social distancing and not having mass movement of people on our beaches. So I endorse that. I also had a call this morning from the chair of the RNA, David Thomas, and of course, you know, it was great sadness that he reported that the Ekka would not be going ahead this year. I know my little niece burst into tears when she heard that. Can I say to all the children out there and the mums and dads that the Ekka will be back next year, fingers crossed, bigger and better than before. And I know it's going to be really hard for a lot of families who look forward to it every year, but we are in a crisis situation at the moment, so we need to make sure that we are looking after everybody and stopping the spread. In relation to our Care Army, we've had 18,000 people already register. Well done, Queensland. We're going to be helping a lot of vulnerable members of our community, and I know that more and more people are going to sign up. So with those few words, I might hand over to Dr. Miles. And sorry, it was remiss of me, I should have said at the very beginning that we extend our condolences to the family of a gentleman that passed away yesterday. Once again, there's a family out there that are grieving, and we know that this COVID-19 has a significant impact, especially on our elderly and most vulnerable in our community, and it's a very sad day for the family. So I'll hand over to Minister Miles.
Thanks so much, Premier. That 14 positive figure overnight is another great result for Queensland and underlines just how effective we are all being together at keeping our distance and keeping ourselves and our communities safe. Of those 921 confirmed cases so far, we consider 743 of those to be active, meaning that 173 are confirmed to have recovered. 43 remain in hospital. Of those, 12 are in intensive care and 10 are ventilated. It was tragic to hear the news that we had lost another Queenslander to COVID-19 yesterday afternoon. That of the 5 Queenslanders who have died from this disease, 4 have come from cruise ships, as did that 78-year-old gentleman. But the positive figures and the ongoing reduction in the average number of positive figures demonstrates just how what we are doing is working. We are slowing the spread, and all Queenslanders need to keep it up. This extra death reminds us that what we are doing is to save lives, to save the lives of other Queenslanders. All along, we've said that this government would plan for all eventualities, and you've heard us talk before about planning for various spread scenarios. We are also planning to take care of our health workers throughout this outbreak, not just with a plan A, but also with a plan B and a plan C if they should need one. And that's what this investment in possible alternative accommodation for them is all about. It's sending a message to our health workers that no matter what, we have their back. that they are, and taking care of them and keeping them healthy is our number one priority. And so if they need it, we will invest in accommodation for them, accommodation close to their workplace. I want to underline that this is not for health employees who become sick. We've long had a program which provided accommodation to any Queenslander who became sick and did not have appropriate accommodation, and that program has always been available to Queensland Health staff should they need it. This is for Queensland Health staff who are well, who are working hard, who are there, may need to be quarantined or may still be able to work, but for whatever reason their household circumstance means that they don't feel safe to be going home or quarantining at home. They might have a child with an immune disorder, they might have an elderly parent living with them, and all of those things can be taken into account. This government, since the day we were first elected, said that we would put health and our health workers and our frontline health staff first, and we are doing that again today with this $17.5 million investment.
Thank you, Minister. So over the last few days, we've seen a significant reduction in the number of cases here in Queensland of COVID-19, which is excellent news. It means that our strategies that have been put in place are working, and thank you to every single Queenslander who's been adhering to them. It's not easy, I'm absolutely convinced of that, but people have heard the message. Now, we have seen out of those cases, 32 cases that we don't know where the person actually acquired it. So it wasn't from someone who'd been overseas, it wasn't from a confirmed case. So therefore today, I'm going to be asking healthcare workers to increase the people they are testing, even if they don't have any travel history. And I've asked for that to be done in the Gold Coast, in Brisbane and in Cairns, as that's where we've seen those cases. So it doesn't make any difference to anyone who's out there, but it just means that when people present to their GP or present to a fever clinic, that they'll also be tested for COVID-19 if they have any respiratory symptoms. So that's cough, sore throat or shortness of breath. So we'll be doing that additional testing to just get a picture of whether we think there is any community spread happening through one of our communities. So those places are Gold Coast, Brisbane and Cairns.